Good evening, Shyamalda.
Good evening, boss. How are you?
I am fine, sir.
Great.
Nice to meet you on this web meeting.
Yeah.
And
Nice to see you in good health, in good position, and very happy mood
yes,
with your ambition of becoming the FOGSI Vice President. Thank you very much. All the best, boss.
yes, sir. Let for all viewers, let me introduce you. Sir is Dr. Shyamal Sett from Kolkata. He is just now Senior Vice President of Bengal Obstetric and Gynec Society. And sir was MTP committee chairperson in FOGSI in the year 2015 to 2017. And we were behind him, following him rather in FOGSI. So, sir, welcome to web meeting.
Thank you very much for your nice introduction. Thanks to everybody, whoever is watching this program or who will later on see this video clipping. And good health to everybody. So Dr. Sharma, the question that goes into it's maybe in everybody's mind. Now, what should be the actual guidelines and precautionary protocols during this COVID time or COVID period? If somebody wants to provide surgical method of MTP to his or her patients, protocols, precautions. You please highlight on those points which are must, and if somebody doesn't follow to those guidelines or to those protocols, one may be in trouble. Please highlight on those points.
That's a very nice question, particularly in this COVID era. I will throw light on a few things. First of all, whether MTP should be done or not.
Yeah.
That is the first question.
Yes.
So, see, MTP is not an emergency, although, but still, in a few conditions, like suppose patient is around 11 weeks, and if you will not do MTP, then that patient is going to cross limit of 12 weeks, and then it will be a second trimester abortion. So, suppose patient is around 19 weeks, then again the problem is same. If you will not do, then it will cross limit of 20 weeks, and then it won't be possible according to MTP Act to do MTP. So MTP, though not emergency, but it should be done.
Yes.
Okay. Now, second thing, what are the guidelines? So regarding the guidelines for doing MTP, see in India, after 25th March, there are more than 500 notifications for COVID. So every day, even the guidelines changes. And
yes.
Guidelines, national guidelines says something else, ICMR guideline says something else, guidelines given by associations says something else, and guidelines given by our local authorities are something else. So they are not uniform guidelines. So the thing is that we are supposed to follow our local guidelines given by our local authorities. So that should be followed. Now, regarding MTP, there is no guideline, specific guidelines are being given by government or by any local authorities. So, basically, we can take our own decision. So, doctor can take his own decision that whether he wants to do MTP or not, or whether that patient is eligible to undergo MTP or not. So, that is one thing. Now, while doing MTP, a few precautions should be taken. Now, all guidelines given by appropriate authority regarding COVID testing is to be followed. And while doing MTP, you should take precautions. Now, what precautions you should take? So, if possible, avoid general anesthesia. So, if you can avoid, you can do MTP in paracervical and sedation. So, if you can do that in the presence of anesthetist, you can do MTP in paracervical block and IV sedation. Now, if it is not possible, you are supposed to give anesthesia, then precautions related to general anesthesia is to be taken. Now, what are those precautions? That anesthetist and only one assistant should remain in OT. Minimum person should be in the OT at the time of giving general anesthesia, and shield, plastic shield should be put while intubating or while giving anesthesia, that type of precaution should be taken by anesthetist. Now, after giving anesthesia, after the pause of some time, surgeon should enter, and surgeon should wear precautionary things for his own precaution. So you should wear PPE kit, and it should contain goggles, as well as foot should be covered, so that while doing MTP, no blood or no material coming out should touch your foot also. And the suction should be attached with the bottle, and bottle ideally should be contain a hypochlorite solution, so that as soon as any product of conception will come out, it should be directly going into the hypochlorite solution, and the virus will be taken care of. So these are the things which are to be taken care of while doing. No clear-cut guidelines by anybody, because nobody knows till date that whether there, even today there is a controversy that whether COVID is a virus or whether it is a bacteria. So that kind of controversy is still not cleared, and nobody knows. Every day there is a new guideline. WHO previously was saying that it was a infection transmitted from surface, and now they are telling that from surface you cannot get it transmitted. So every day there are new things coming. So till date, we should follow the guidelines given by our local authority as well as by FOGSI, and we should take a maximum precaution to save yourself from the problem.
So thank you very much for your elaborate discussion on this point. Now, one more thing I want to know related to this is that, suppose during the procedure we admitted the patient after doing a COVID test and it was found to be negative. Now, during the period of hospital stay, if the patient acquires infection from the hospitals and later on proved to be COVID positive, is there any burden on the consultant or the hospital?
See, burden on hospital is to prove in the court of law that they were diligent, means they had taken enough care not to transmit infection. So for that, you have to prove in the court of law that your staff is trained, doctor has taken enough precaution not to transmit. You have displayed the boards in your OPD, you have given training to your staff were well equipped with mask and this PPE or whatever precautions they are given, gloves, or suppose that material to wash the hand, 70% alcohol is to be provided. So if you have taken enough precaution, if you have given enough training to your staff, if you are cleaning your OT and the surfaces in your hospital frequently, and you are maintaining the documentation of the same. So if you have taken enough precaution, you cannot be held responsible. Now suppose patient sue you, then patient has to prove in the court of law that I got this infection from hospital only, and what negligence was there from on the side of hospital. And it will be very difficult for the patient to prove that he has communicated or transmitted corona only from the hospital and nowhere else. So there is nothing to worry in that situation. It will be easily defendable.
I think all the members who have been watching this conversation clippings would like to know whether and how you need to counsel the patients before admission on this point particularly. Yes. Or is there any necessity to take any kind of separate consent on this?
No, we do not recommend any kind of separate consent, because it is of no use, because even after giving consent, patient can definitely sue you. And even if you have, after taking consent, you cannot be negligent with the patient. So consent is a paper only. It has no value in the court of law to save you. So we do not recommend any specific consent. But if you are taking procedure specific consent, you always tell that in that you have to add a one line that in the era of COVID-19 pandemic, even we do not know that how it is transmitted. So it is always possible for the I can say complication in reference to COVID-19 can happen to you. So only that line can save you, the court of law.
Sure. Because it's very difficult to prove that the it is an acquired from the hospital itself. It may be acquired during your auto rickshaw journey even. If the patient comes and goes back by an auto, it can be transmitted there as well. Anyway, thank you very much, Dr. Sharma. It's very nice conversation with you. I think people who have been watching will be benefited out of this conversation.
Thank you
so much. Take care, stay safe, and have a good health.
You also take care, and hope everybody is now fine in Calcutta after that disaster.
So, thank you, sir. Thank you, boss.
Thank you.
Thank you so much.